video because one of my patients said, you really need to put out there how you treated me. I think you made a big difference in my life, and you really need to let people know. This is really important information. So I've been doing community health. I did a fellowship in community health, and so I sort of latched onto that idea, and I decided I should make a video with some of my patients and sort of let the community know how we're treating our patients with COVID and how they're doing. There was a lot of articles that came out of China and Korea who were exposed to the virus before it came to the United States, and I read the articles. And when I read the articles, I actually really came with the concept that this disease is treatable. If what I'm reading is actually true, there's certain drugs we can use to either mitigate the disease or just to flat out cure it. So I came up with a whole regimen that I believe would work. What happened though after that was really interesting is shortly after I come up with the regimen and I was sort of, reading through the textbooks and coming up with concepts and reviewing immunology and cell biology, a patient calls me and says, what they're talking about on the news, I have that. And that shocked me because I got the call maybe March 11th, March 12th. And so I said, well, I have something that I think will treat you, so let's start treating. And I have to admit that was a shocker because I was expecting someone to call me maybe May or June. I wasn't really expecting it to happen really so fast. So I gave her the medications. I did go over the symptoms with her, and of course they were classic COVID symptoms. She is a professional skier who lives in Colorado, and so she had the coughing, she had the chills, she had the night sweats, she had the fevers, and she just said, I'm so sick. The original articles that I had read, they basically said that it starts off as a sinusitis. And it's a sinusitis and it's sort of like a mild bronchitis. And then it progresses to this terrible pneumonia. So the concept is that the sinusitis is treated with the doxycycline, and then the bronchitis and the pharyngitis is treated with the Z-Pak. But that's my general concept. And then there's a cellular concept of it about how viruses replicate and gene expression. And I feel that the doxycycline treats the replication of the virus. And I feel that the azithromycin helps treat the gene expression because antibiotics are usually used for bacteria, not viruses.
There was a lot of research, and a lot of that research has kind of been discredited, but I don't know if people have still fully understand how hydroxychloroquine works, maybe in very early disease. So what Vivi's talking about, these are patients who have either been tested positive or have classic symptoms, and they have called her because they have nowhere else to turn. Many physicians don't treat it, or what do they give them, Tylenol, and that's it?
Most of the physicians that, from my patients, have been given Tylenol.
Okay, and patients are scared, they have nowhere to turn, they're getting sicker by the day, and they have no idea what to do. Some of them have been referred to my sister from other patients. Some of them were referred through friends. Thank goodness they've reached out to her while they're still at home. And the whole idea is to treat patients so they don't go to the hospital, do not overwhelm our medical system, and stay off of ventilators. So to this date, none of her patients have had to go to the ER to be looked at, more or less admitted. So that's the most important thing. So basically what I want to say is she was doing her research when she was talking about doxycycline. It's very interesting. There's still a lot of talk about the hydrochloroquine, even though it's looking like maybe it's not as effective as people were hoping. But both of them are anti-malarials. So I don't know if that's related at all. I can't really say. But doxycycline doesn't just treat bacteria, it's also anti-malarial. And what's the virus that it treats?
Dengue fever.
Right. So it's not just an antibacterial. It has a broad spectrum of other things that it treats as well.
Yes, that's true. There was a push for the hydroxychloroquine, and how the hydroxychloroquine presumably works is it helps zinc to get inside of a cell, and zinc is commonly known to stop viral replication. And doxycycline likely does the same thing, helps get the zinc inside the cell. But doxycycline is a very safe antibiotic. I've given it to kids, 15-year-olds, for acne. Azithromycin is also very safe. I've given that to children too, specifically when they have, sore throat or something like that.
Well, Vivi also, and myself, we actually had patients come to us asking for, early on, asking us for hydrochloroquine prophylaxis, asking for prescriptions. And what did you tell them?
I told them no, because early on I knew it was toxic. Before they were even really talking about how toxic it was, I couldn't imagine me treating any patient with any drug that I thought was toxic outside of the hospital.
This is a video for, as a public service to get some information out to patients. But of course, people are all over the country. They need to, of course, speak to their own physician, and no patient should treat themselves. No patient should try to get hold of a prescription somehow. It needs to be followed by a physician. And I personally believe every patient that Vivi has treated, she has followed up with them every single day until they really feel that they've fully recovered. COVID is, as we all know, it can be a very dangerous disease. So the progression of the disease needs to be managed. Because, for example, somebody could have COVID, but they also have diabetes. Their COVID needs to be treated, but then also, their diabetes needs to be properly managed. So if people have pre-existing conditions, that all needs to be taken into account. The high blood pressure, all of that needs to be taken into account. Nutrition, everything. When the doctors are treating patients with COVID-19.
When a patient calls me, I basically go through the symptoms. They tell me how they're feeling. And then after that, I tell them what the protocol is. I want to make sure that they feel comfortable with it. And then I ask their permission, would you like to do this? And they tell me either yes or no. And so at that point, I prescribe them doxycycline and azithromycin. However, although those are the two antibiotics, I also explain to them that I think that there's some oral hygiene that needs to take place. So I tell them to gargle with salt water, and I give them a recipe for that. And I also tell them to gargle with hydrogen peroxide and water. You can get the hydrogen peroxide at the local pharmacy. And then I tell them to add like a half a teaspoon of hydrogen peroxide to like 2.5 teaspoons of water. And then the warm salt water gargles, they do 3 times a day. The reason I have them do that, because initially, from these articles I read from China, the COVID virus lives up in the sinuses, all up in here. And I feel that gargling, that warm irrigation can kind of help loosen up that virus that's all stored up in there. And if you can dilute the virus, it probably won't progress, in my mind. And so I have the oral hygiene regimen. And then I also have the supportive care regimen. And the supportive care regimen, which I think is really important, is promethazine DM. It's basically a cough syrup that you take at night. That cough syrup is also an antihistamine. And so I tell my patients you take it whether you're coughing or not. If the patient is coughing, then they take that cough suppressant 3 times a day rather than just at night. And then I have a micronutrient regimen that I actually think is really, really important. And in that one, they take vitamin C, 1,000 milligrams a day, vitamin D, about 25 micrograms 3 times a week. And they also take zinc, 12.5 milligrams every day. And so in this regimen, I do think that all of it's important. That's why I call it a protocol. I've spoken to other doctors who say, oh, I just have my patient on doxycycline. And I think that's great, because I do think that the doxycycline slows down viral replication. But I think that you need to be on the whole regimen. And I have other doctors who say, oh, I give them azithromycin. And that's great, because I feel like that hinders some of the virus gene expression. But I do think that the patient needs the whole thing. So if you've been exposed and you're worried about having COVID, but you're not believing that you have it, you just have the exposure, I really believe the vitamin C, the vitamin D, and the zinc, and also the salt water gargles and the hydrogen peroxide gargle, I feel like that's a great method. Honestly, to date, every single patient of mine that's on that regimen, not a single one has ever contacted COVID. Not to say that they won't, but they really haven't. My patients who have not been on that prophylaxis are all the ones that have contacted COVID. So I've treated about 30 patients, and none of them had to go to the hospital. None of them had to be admitted for COVID. None of them had to have treatments with ventilators or anything like that. So I think the key to this is early intervention. I think that that's the key. And so that's why I'm making this video, because so many people have COVID and so many people are passing away. And when I see these people on TV, I do think in the back of my head, if I had only had access to that patient early. So I'm making this video so patients can talk to their doctors about it themselves. Mm-hmm. A doctor seeing another doctor using this protocol, a doctor might go back to some of those articles themselves and research it, and maybe they'll open up their minds and be a little bit more aggressive in treating these patients early, so we can decrease the hospitalization rate and the death rate.
Yeah, and I think the biggest thing to know is doxycycline, azithromycin, mm-hmm. very, very safe medications. And of course, the holistic medicines, vitamin C, zinc, vitamin D, those are holistic things. We all know those are very safe. So the oral cares, we should be doing oral care anyway. So overall, it's extremely safe, even in people with many pre-existing conditions. And the most important thing is the hospitals do have some effective treatments now. They say you don't want to wait till the patient gets to the hospital. At that point, who knows what can happen. Some of them will get better, some of them won't. Patients need to be treated in the community by their family physician, by their community physician if they're sick. And that will cut down on overwhelming our hospital systems and also cut down on death.
I have put together a slide presentation to discuss how I have approached treating my patients for coronavirus. I use 2 antibiotics. The 2 antibiotics I use are azithromycin and doxycycline. I use azithromycin because I believe that it interferes with the large ribosomal subunit on mitochondrial and host cells. I use doxycycline because I believe doxycycline interferes with the smaller subunits on the ribosomes of mitochondria. I believe that by blocking the large and the small subunit on cellular mitochondria means that the coronavirus is unable to take solid hold of a host cell and therefore is unable to utilize a maximum viral response in relations to gene expression and viral replication. I have my patients to gargle with hydrogen peroxide in the morning and at night when they are infected with the coronavirus. The reason why I do this is a coronavirus initial infection is an upper respiratory tract infection. This means that coronavirus infects the nasopharynx and infects the back of the throat and also up within the nasal passages, and it also becomes a sinusitis. I believe that this gargling with hydrogen peroxide can decrease the viral load that's expressing in the back of the throat and up in the sinuses and in the nasopharynx. And as a result, I believe that this can mitigate the coronavirus becoming a lower respiratory tract infection. And it also can mitigate the coronavirus becoming a systemic infection, in which it ultimately can be. I also have my patients to gargle with warm salt water as well. I have them to warm the water to about 80 degrees or maybe even a little bit warmer. I feel that micronutrients are a very important aspect of me treating my patients for coronavirus. Therefore, I have my patients to take vitamin C, zinc, and vitamin D. I use the vitamin C because vitamin C is known to be an excellent antioxidant, and it is also known to be a nice supplement for individuals who have coronavirus infections, such as a common cold. And I use the zinc because the zinc is also documented in being able to interfere with viral replication. An added benefit of the doxycycline is that the doxycycline does bind to zinc. And I believe that the doxycycline might also assist in having zinc being carried over the cell membrane and into the cell, therefore helping block the viral replication in relations to the coronavirus. I have my patients to take vitamin D because vitamin D is known to be very important in the inflammatory response within the human body. I believe that the vitamin D helps normalize immune response in individuals. I believe that supportive care is very important in treating patients for the coronavirus. In terms of the supportive care, sometimes I give aspirin to my patients. Coronavirus patients sometimes have blood clots within their toes or their fingers or within their legs. And I also sometimes give patients aspirin because coronavirus patients can also have strokes and they can have heart attacks. Another supportive care medication that I give my patients sometimes is Pepcid. Coronavirus sometimes gives patients GI upsets, and Pepcid has been documented in possibly mitigating some of the hospital stays in patients who were exposed to the coronavirus. And all my patients with coronavirus, I give all of them promethazine DM. I give it to them because promethazine has a nice anti-inflammatory aspect to it. And I feel that that helps the patients who are infected with the coronavirus mitigate the immune response in relations to the coronavirus, which is possible. And sometimes I give my patients promethazine DM every 6 hours if they are having a cough in relations to the coronavirus. I believe that homeopathy is very important in relations to the coronavirus. And so the homeopathy that I recommend for my patients is chicken soup. I have them take the chicken soup at least once a day. Chicken soup is a home remedy that's been around for years and years and definitely has been documented in being very helpful in patients who've had viral infections. I also feel that electrolyte balance is very important when fighting an infection such as the coronavirus. So I have my patients to drink coconut water every day, about 8 ounces, or they can use an electrolyte drink that they make at home themselves as long as it doesn't have added sugar. I also recommend hot green tea in my patients with coronavirus. Green tea is an excellent antioxidant, and I recommend that they drink an 8-ounce cup of green tea a day. For all my patients with coronavirus, the absolute minimum for my patients, I believe, is azithromycin, doxycycline, zinc, and the hydrogen peroxide gargle. The best option is to prevent the coronavirus. In terms of coronavirus prevention and staying healthy, I recommend that my patients continue to social distance. They wear a face mask, wash their hands regularly, they keep hand sanitizer handy for time soap and water is not around, that they drink 1 glass of green tea a day, avoid sugar when possible, eat nutritious meals, shower once inside their homes after a day out, and that they gargle with hydrogen peroxide and water every time they enter their home from being outside. COVID symptoms, I'm going to review the COVID symptoms. The classic COVID symptoms include cough, shortness of breath, and fever. Other symptoms for COVID include loss of smell, loss of taste, rash in mouth, hiccups, chills, night sweats, body aches, headaches, sore throat, runny nose, congestion, sweating, vomiting, gastric pain, diarrhea, loss of appetite, rash, COVID toes, heart attack, stroke, aches and pains, fatigue, feeling weird or off, pressure, tightening in the chest, muscle aches, confused, coughed up mucus, blocked nose, rapid heart rate, and eye infection. When were you first diagnosed with the coronavirus?
I was first diagnosed back on March 24th, which was about a week and change after my son came home sick. I was already working from home, and he came home from work with a dry cough. And I immediately called my partner and said, "Don't come home." 5 days later, I started to feel ill, and 7 days later, I was pretty much down for the count. On day 5, I actually called the doctor's office and they actually prescribed me an antibiotic and Tamiflu. A couple days later, I literally woke up feeling like there was an elephant sitting on my chest. And every time I took a breath, I felt like someone was shoving a knife through my lung. At that point, I called the doctor again. As a person who has had pneumonia twice before, I knew something was really, really wrong. They had me come into the respiratory clinic. When I was there, they did a COVID test. At that point in time, the doctor basically said, "You have reduced breath sounds in both your lungs. I'm going to assume it's pneumonia related to COVID. I would treat this the same way." And the treatment was hit the inhaler every 4 hours. I was given a cough syrup to help for sleeping at night and only to take it at night. And Tylenol as needed for the aches, pains, and whatever else. Oh, and continue to take the Tamiflu and the antibiotic. 24 hours later, not feeling any better, I called back in. They're like, "Well, the only thing we can do now is send you to the urgent care." So I went to urgent care. I got a nice IV fluids. And I will say that actually helped. That was probably at that point in time a good thing for me. At that point in time, they gave me the other flu test. They took a chest x-ray and they did a C scan. The other flu test came back negative, so they told me to stop taking the Tamiflu. And yeah, go ahead and stop taking the antibiotic. The chest x-ray showed that I potentially had, it was inconclusive per se, but it looked like I had COVID-like symptoms, like there was some COVID-like stuff going on in there. So they sent me home and said, self-quarantine. The day they tested me for COVID, which was the day before, they sent me home with a diagnosis of just assume you have COVID. The test came back 7 days later, because back at the time that I took my exam, it was 7 days till you got an answer. And when it came back positive. At that point in time, my son couldn't get tested because he was in the wrong age group.
Mm-hmm.
He was too young because, can't affect young kids, right? Mm-hmm. When I say young kids, I'm talking mid-30s. My son went through the classic progression. He had the cough, then he had the body aches, he got the high fever. He ended up being sick for almost 2 months too, by the time all was said and done. My understanding is you'll see an oxygen level drop before any of the other symptoms hit.
Yeah, that is true. That can happen. And it's good to know because for patients who are really low on oxygen, they can make it to the emergency room in time to get adequate care.
You start dipping at 95 or below, you probably have COVID if you are an otherwise normal, healthy person. If your oxygen hits below 90 on a regular basis, get your ass to the hospital and don't drive, call an ambulance.
Right.
Because you're hypoxic at that point.
Right.
If I'm getting the term correctly.
Yeah, that is correct. That is the correct term.
I remember, one of my worst days was when my son also hit 105 fever. And my first inclination was to go to the sink, cold water, get, wrist compresses, forehead, behind the neck, bottom of the feet, because he was burning up. And I literally sat at his bed and just kept swapping out the cold compresses while waiting for the Tylenol and Advil to kick in.
It's quite an ordeal in your family, really. You're dealing with one sick individual, and then you, as a caregiver, become sick. That's really a lot to deal with.
I don't wish it on anybody. And that multiple families are going through that. And senselessly, based on what I'm seeing and hearing nowadays. And once I started going through the treatment that you provided, 3 days later, I felt semi-human. A week later, I tested negative. And the other thing that I do want to say is, after having had your treatment, I called up my doctor's office, and because they would only allow respiratory therapists work with you, my primary care couldn't even treat me for this based on the type of system that I was in. You have Kaiser Permanente, and then you have things like Sutter Health, and then you have, and Sutter Health is a primary care, they're just a group, but they're not necessarily an HMO, but they treat like one. And the reason why I say that is when you get some of these big groups, the thing that I was informed when I said, hey, here's what my doctor did for me. And they're like, yeah, we've heard of stuff like that. We've heard that it works for some people. We're not allowed to treat that. It's not approved. And until they call it approved, we can't treat that way. They're still not treating that way as far as I know. It's a go home self-quarantine, you'll get an inhaler, that's about it. If you want this type of treatment, you're going to have to find a doctor that is not attached to a medical facility like a Sutter Health or a Kaiser or any one of those big conglomerates, because they have to follow what their board says. They're not doctors who can practice medicine. They have to follow the formulary. Meanwhile, people are getting sick and people are dying. And people are getting sick in a way that they necessarily don't need to.
So how did you come across Dr. Lee Stafford and helping you with your COVID?
I didn't come across Dr. Vivi Stafford. And I'm going to do a shameless plug for Facebook, which for a long while I hadn't been on Facebook because I just got sick of all the crap on Facebook, I'll be honest. But I will say this is the one time in my life that I think Facebook probably saved me. And I had posted a picture of me and my two faithful friends sitting at the end of the bed saying, the COVID quarantine crew. And you saw that. And then you asked me a question. Dr. Stafford asked me, are you being treated? And the long and short of it, I said, if you consider an inhaler treatment, then yes, I'm being treated. If not, then no, I'm not being treated. And you did something I haven't seen doctors do since I was a kid, actually. You reached out. You called the pharmacy. You made sure that the drugs were there and the right drugs were there. You called me every day to follow up. and tweak and or modify as needed. And to remind me to do things like have my chicken noodle soup. I haven't seen that done from a doctor literally since I was a kid.
And so how did
So
you go with your treatment and all that?
it was an amazing piece of work. You know, do I think I eventually would have gotten better without the treatment? Yeah, probably. It probably just would have been another 3 weeks versus getting better. And it took me a little longer than I think some of your other patients based on our discussion. I think it took me about a week. But if I could have only suffered for a week versus suffering for 6,
Were you surprised when the result came back positive?
I wasn't surprised because my friend already tested positive already.
So what were some of your symptoms?
I had a forever fever that wouldn't go away from 99.5 to 100.5. Also appetite.
Why did you decide to be treated with the coronavirus?
I was sick for 7th day already. So, and when the test result came back positive on the 7th day, I was like, oh, I don't want to be sick no more. So what did I got to news? And then Jason told me about you. I was kind of skeptical at first, but I was like, I'm just going to try out.
So when your friend Jason reached out to you, what did he tell you?
He just told me this doctor can treat you, make you better. And I have to say, I was pretty skeptical. Because no, the news said there was like no cure, no nothing.
So how did you reach out to Dr. Vivi?
On Facebook. She told me, yeah, I could treat you right now. And I said, let me get my test result back first. And then when it came back positive, yeah, and you treated me. Yeah, you told me, there's a new like CVS, and it's like 5 minutes away from my house.
I don't know if you remember, but when I first reached out to you, I said, your symptoms were sounding pretty convincing. I don't know if you remember, I said, why wait for the test? Let's just, And you said, no, I want to wait for my test.
Well, I was kind of skeptical. I was like, should I trust you or not? I was like, maybe I'll get better by then, like by the test.
Right. Between the time that I spoke with you and said we should probably just treat now, and you said you wanted to give it a few days and see what your test results were, what were your symptoms? Were they slowly getting worse, or were they exactly the same, or do you feel like they were getting a little bit better? Where do you think your results were, in that short time period, maybe 3 or 4 days?
It stayed the same. So this is a fever. So when I take like an Advil, Tylenol, it get better. But after when it runs out, I get back to sick again.
You got back sick. So why did you decide to be treated for coronavirus? Because you mentioned you were a little bit skeptical and it was lingering. What do you think was what really made you decide, I just want to be treated for this?
What do I got to lose? Like, I'm just going to try it.
So after you were treated, did you feel better?
The second and a half days, yes, felt much better. Like third day, like my fever was gone. I was like, is this a fluke or? And then waited another day, it was gone. So I felt like much better. And my appetite came back.
Now, did you ever have any loss of taste or smell, anything like that?
No loss of taste or smell, just loss of appetite.
So do you believe the treatment helped you to feel better, faster, and if so, why?
Oh yes, I do believe it. At first, I thought maybe like it was my 10th day already, and maybe that's how I got cured. But then my mom took the treatment right when she showed symptoms, and it was better in 3 days. So I was like, oh, this is legit.
So I would presume your mother, she got it from you, is that right?
Yes.
So did you get a repeat test to see if you were negative?
Yes, I did. I took another test and came out negative.
Are you glad that you were treated for the coronavirus? And if you are, why?
Oh yes, I'm glad I was treated for it. Now I can tell I tell all my friends that you got the treatment for it. Like you can be better. Like you don't be scared. Like
A lot of people have this fear, there's a real fear. I mean, people wear their face mask, but even with the face mask, you can see that there's fear out there. And you make a really good point, knowing that there's a way that you can take control over your symptoms with some medications. Just something that simple can make something that sounds the unknown sort of scary. Now there's something you kind of know, which makes it far less scary, I would think. So I think you hit a really good point.
if you catch a coronavirus, everyone should take the treatment. Like what do you got to lose? Like it works. Our patient recover 1 to 3 days or get better. Like why go through that lingering effect?
Well, I certainly agree with you. That's why I prescribed them. The medications I've used them many times in kids, patients that are 16 years old. I mean, I've been using those medications for years. So it's sort of enlightening to see how you can combine a lot of medications that you use, sort of combine them in a certain pattern to fight a virus. So even myself as a physician, I think I've learned a lot from coronavirus, because I never imagined ever in my career I'd be using antibiotics to treat a virus, and here I am, and it works.
I had just started feeling sick when I was getting back from a road trip, and then I had gotten back probably March 6th. Started to feel blah, but it was just a blah feeling for a while. But there was about a week or two where it was just, I don't think anything's wrong. Yeah, the feeling of becoming bedridden probably happened overnight. Went to bed one night and then woke up the next day and felt like I had 10 or 20% of my energy. And then from there I walked downstairs. I think they were making bacon. I didn't smell it. I was like, I can't smell anything. And then it turned into, I think I drank an orange juice, and it's not that I couldn't taste the orange juice, but it was very, very bland. But once I got to the point where it was the blah feeling and I lost the taste, it's very much mushy right now in my head. Yeah. The non-smelling, non-tasting, then the feeling blah got worse to the point where I couldn't get out of bed. That lasted for a few days, and then it felt like it did get better. Couldn't smell or taste anything still, but I was actually just able to eat. But it was feeling better. I was like, okay, I must be one of those people who got over it. And I drank a couple of beers that night, and then woke up the next day, and it was probably 100 times worse. I think I collapsed in the kitchen floor when I was taking my dog out for the morning, and I was like, I can't do this. Where I'd stopped getting out of bed, I was having back pains that I normally hadn't. It felt like a burning sensation in my back mixed with like I slept wrong, but I didn't sleep wrong. So all sorts of weird pains and aches. And so we had talked through Facebook about a day before waking up feeling awful. And so I think from then on, we were just in contact with what to do every couple of days. Again, I don't remember, but I remember we had been FaceTiming throughout the first few days of this and going over what medicine to take. And I was taking 2 different prescriptions. And I remember starting to feel like the prescription medication was kind of giving side effects, but at the same time, I wasn't getting better or worse, and so I just felt like, okay, maybe this is working. So that was probably all within a few days. After starting the medication, there was a difference. Like there certainly was, but I don't know. This lingered, and it still kind of does. So it's hard to explain. Like I'd say it's weird things are still happening, but right away feeling better. Yeah, after a few days, but it still lingered for a few more days. I remember, when did I get I remember the day I got the smell back and walked downstairs like, oh my God, I can smell again. That was like a month though, right? That felt like a good solid few weeks. But again, this is all mush mash right now. After the first 3 or 4 days, I lost the feeling of, oh my God, I'm so exhausted. So after the 4th day, I went to sleep and I could wake up and, okay, this feels like a better day than it was yesterday. I feel better today than I did yesterday. And I bet you I probably gave percentages. Like, I'm feeling 10% better today. I'm feeling 30% better. I'm feeling 100% better today. And that was probably, after a week or 2. I wouldn't classify myself as 100%. I'd say on a normal right now, I'm 99.9 because there's a lingering doubt in my head of certain events that will happen that spark and go, whoa, this isn't normal. Like playing basketball, I'm not running, I'm just shooting the ball and dribbling it and walking, and I'm drenched in sweat. Or I'll have bouts of extreme exhaustion and I need a nap, and I wake up, I just need another nap, and I wake up after that nap and I'm not even hungry, I just want to stay in bed, and I'll just go to bed. That happens once or twice a week since then, and I've never felt like that before ever. I remember feeling like stomachache side effects right away from the medicine, and I'm weird like this, but that told me, okay, good, something's gonna happen. Like it's a different pain. It was different than the pains I was experiencing. Okay, I have faith. So I had it was a mental thing for me, but it took probably a couple days before. And again, I wasn't sure if that was from the medicine or I just was facing a 2 or 3 day really bad stretch here, and the medicine just helps get rid of it quicker. I didn't know, but definitely a couple days. Had I not taken the medicine, what would have happened? Would I have been stuck with that pain that I was in for 2 or 3 more weeks? I can't imagine anything like that. So I don't think things just get better on their own. The timing is awfully coincidental, but maybe it was only going to be a 3-day bug. I can only compare to things that I've read, and I've tried not to read too much because it's just so crazy and depressing, and I can't tell what's real or not real at the same time. So I can only know my own personal experience of that. So I think it did.
So we came down one morning and he said, it's really weird, I can't smell anything. And immediately, because COVID had started and we were all anxiously looking at what the symptoms were. And so when he said he couldn't taste and he couldn't smell, my eyes just went, what? So then we were just waiting to see what would happen. Do you have a fever? He had no fever, but he was exhausted. And then that went on for a day, and then the next day, I was chatting with Vivi on Facebook or wherever we were chatting, and I had mentioned that he couldn't taste and he couldn't smell, but he told me this morning he was feeling better, and that's when Vivi said, you need to put that kid on doxycycline and the Z-Pack. And I said, but he's feeling better. She said, I think it would be a really good idea to put him on doxycycline. And actually she said doxycycline, and I said, I wrote back, oh, is that the thing that the president is talking about? And she goes, interesting you would say that. No, that is very toxic. This is the kind of antibiotic that we give kids with acne. It's very safe. So then I was like, oh, okay, that sounds better. She said, I'm calling in a prescription right now. I sent Ben out because he said he was feeling better, and I'm like, I know you're feeling better. Just go out and get this. You might as well. You've got nothing to lose. You should do it. So he came out, and when he came back, he nearly collapsed coming into the house. It's like he went from here to there in a matter of hours. And so she had quarantined him upstairs and said that's just, he needs to stay, which he did, and we Lysoled everything. And so 72 hours later from him, every morning he would come down to let his dog out, and we would say, how are you? I don't know, I might be feeling a little better. Day 1. Day 2, how are you? I think I'm feeling better. Day 3, how are you? I really feel a lot better. And that was 72 hours, and he was outside playing ping pong. So we were ecstatic with that. Still quarantining him. I think Vivi had us quarantining him for 2 weeks, sitting in the other room. We would have dinner as a family. He would sit in the other room and have it when he finally got his appetite back, which was about 72 hours after. And that was kind of the whole genesis of his experience from a parental point of view. And Vivi immediately had put all of the rest of us on a prophylactic of doxycycline, and we did gargling, and we did a lot of vitamin C. We did airbornes and emergencies, and then the gargling, and we did saltwater gargling, and then we did hydrogen peroxide, 1 to 2 parts or 1 to 3. And one thing Ben did not mention is when he did the gargling, day 1, when he started, he said the amount of dark colored phlegm, I know it's gross, but the amount of dark colored black phlegm that came out of his mouth, he said he'd never seen before. So there was obviously something right here that he was, for lack of a better word, expectorating or whatever, and getting it out, and that was great. He may have these things that he talks about that are lingering, but I think they're quite minor, thank God. And hopefully that's the end of it for him.
My name is Greg Ruth. I'm a physician here in Colorado, and Vivi and I were classmates. So she asked me to do this, which I am very happy to do and very grateful to do. So my story was that we were off for work. We have an outpatient clinic near Boulder, Colorado. And so we were off from the end of March to the first week in May. And then we'd been back to work basically full time after the shutdown was done, after the isolation was done. And I worked for a couple weeks and was doing great. We had one little birthday party we did in the cul-de-sac. Like, everybody had been isolating, so no one had really been out with other people or in crowds. So that was probably right at the beginning of June. And a day or two later, after that little get-together, I started having some GI symptoms, like some diarrhea, and just felt really tired. We went on a little walk we usually do with the dogs, and I could hardly make it. Had a little cough, and it was just the strangest thing. It's like, that's not like me. And we got back, and it kind of got worse throughout the day. So we called in to, you can't be seen anywhere during this COVID crisis face-to-face, so they have you do an online virtual visit. So I did that with a PA, and he talked to me and said, yeah, you kind of got this dry cough. Everyone talks about the dry cough. And, I don't know about the diarrhea symptoms, but, why don't we get you a test, a COVID test? And so they didn't have any available at that time, not any rapid tests. So that was a Saturday. So Sunday, my wife and I drove about an hour and a half to a neighboring town, not really neighboring, but a town about an hour and a half away, Greeley, Colorado, to get a rapid test. And that came back negative. And it's like, I'm just feeling a little better. So it's like, okay. It was Sunday morning. Came back home that night. I felt awful. I had chills and sweats and worse diarrhea, worse cough. And I called in and I said, hey, I'm not going to be able to make it to work. And, there's some question about COVID. And they said, well, you better take the week off then. I'm like, oh, no, I can't. I've got all these patients that are backed up. And I was very frustrated, but I felt sick. So then Monday, my beautiful wife made an appointment for me to see a family practice doc, and I went in, and he said, yeah, it's probably a GI bug or something, but let's get another COVID test. Let's get the antibody test. That takes a couple days to come back. So this had probably been going on for about 3 days. It's like Tuesday or Wednesday now, and I decided I'm going to take some of this Augmentin because it's not going away, and I want to get back. My fever's subsided down a little bit. So by Friday, I've been afebrile for 72 hours. According to CDC guidelines, that was considered reasonable. And my second COVID test came back negative, the antibody test. And so okay, I'm going to go back to work on Friday. And I felt like absolute crap. I was really, really tired, just beaten down. And, I hadn't eaten much, hadn't slept much. And that's, okay. Got through Friday, went through the weekend. And then I think it was maybe that Saturday or Sunday, I called you, Vivi, kind of an unrelated matter, and we were talking about some events, and I was coughing, and you're like, what's up with that cough? And then I just relayed this whole story that I'm telling now, and you said, oh my gosh, I think you have COVID-19. And I said, well, there's a suspicion of that. I came back negative or whatever. And so, Vivi, then so I remember you basically said, hang up the phone. I'm going to call in a bunch of prescriptions to your local pharmacy. And I texted you the pharmacy. And within an hour, I was on 3 different medications and two vitamins. And I stopped taking the Augmentin. So I took the prescriptions that you had given me and the Pepcid as well. And 24 hours later, the following day, I can't remember if that was the Sunday or Monday, but I was 90% better. The diarrhea had stopped, the cough had gone down, no sweats anymore, and I just had more energy. And it was great. So by the time I went back on Monday, I was completely like my normal self. Still a little tired, and whatnot. That was probably the end of the first week in June, June 6th or 7th, somewhere around there. I was on an antibiotic already, and honestly, Vivi, I mean, you're a good friend, and I trust you. I trust your intellect and your judgment, and I know you did a lot of research on it, which I really respect. And, I thought I was taking some antibiotics anyway. I didn't understand why that would help treat a viral kind of thing. But it's like, if you have friends that's working for, I trust you. I know you have my best interest at heart, so I'm going to do it. And I'm really glad that I did. So my brother's wife she's a psychiatrist. They live down in Tampa Bay, Florida, and she had very similar symptoms. Not as much the GI, but a lot of the cough, fever, malaise, and it was just going on and on and on. And she said, tell me what your friend was doing, because I'm not getting anything here other than just rest and, and lots of fluids and the typical viral stuff. And so she tried that, and she definitely improved as well. And she's back working and doing well. The physician I went to initially, the family practice doc that I went to go see, he had very low faith in the rapid test. He thought there were a lot of false negatives, and then it was just not reliable. And I said, well, that kind of makes sense. They kind of rush to get these things out. You're digging around in the nose, and who knows how accurate that's going to be if you can get to the right area. I thought it'd be more accurate, and it could be that I just tested too early. Maybe I hadn't developed any antibodies yet. I mean, or it's just not sensitive enough to pick up the early ones that I had formed. So
Did they test for IgM and IgG, or do you know which ones?
I don't know. I'd have to look it up.
Yeah, I heard that 20% of people that test positive for COVID, 20% of them are still negative for the antibodies. So it's not like you'll necessarily have the antibody.
Yeah, interesting. I'm sure there's a lot of people that test negative that are just walking around and probably have it. That's more of a gut sense, but
Yeah, I'm sure. I think a lot of people have it, or walking around, or aren't even sick, and are just spreading it all over the place. Unwittingly. Of course they wouldn't do that consciously, but I think that's the reality we're dealing with. I think that's why we see such widespread here. What do you think about wearing a face mask?
I do it. I'm not doing it in my home here, but yeah, we just had a flight back from North Carolina. We flew to Raleigh, which is a little airport. And there was one guy without a face mask in there, and another big guy just kind of sitting there. He's not going to do this or that. Another big guy walked up to him and basically started swearing at him and said, this really isn't about you not getting it. It's really about protecting the rest of us. And I thought that was pretty good. I think that's, I don't know, some of the early research I've seen, it's really more to prevent you spreading it than prevent you getting it. But maybe it does a little bit of both, but I'm definitely in favor of it. And it seems to, at least the early data sees to show it makes a difference. Would you agree?
Yeah, I definitely agree. In fact, early on Facebook, I came across an article written in Taiwan, China, abroad, and it was basically talking about, preventing illnesses, wearing a face mask. And I reposted on Facebook that it was a great idea. And everyone was like, where's the science? Where's the science? And I was kind of thinking, I know I did my residency in surgery as well as you. And I was kind of thinking, well, we wear a face mask in the OR for a reason, and it's so we don't spread something to the patient.
Yeah, absolutely.
So I was thinking, hey, I'll probably, if it saves one life, it's probably worth it. So I was feeling passionate about that from the onset.
Now, did you ever hear back? Didn't you send this to the NIH or something, or a guy in Minnesota?
Glad you mentioned that. Yes, I did. I sent it to Dr. Fauci and his group, his team, that little NIH immunology branch. And it sent me one. So I emailed them the first week in April after I treated like 6 or 7 patients, and they were going great. And they emailed me back and said, well, that's a really small sample size. But then, when I started treating more patients and the results were just 100%, like everyone was getting better, then I reached out to them again. And then they said, oh, you should put this up on our website. They have like an NIH website for doctors who have treatments that they feel are effective. So I put that up on their website, and I still didn't hear anything after that. So I contacted them like 2 or 3 or 4 times, and they were like, oh, well, just make sure you put it on the website, which I've done, and that's a little bit, I think that's a little bit unfortunate because there's so many people dying. it would be really great if a treatment like this had more standardized medicine opposed to the community doctor, sort of doing the methods thing. It would be nice for it to be, the next step of being scientifically shown, how much it can help.
Yeah, at least do some, promote some studies on it or something like that. Yeah.
Right, yeah, I think that would be really important. But I did tell them, the most important thing is that I did tell them, but I have to admit they haven't been very receptive. That's just the truth,
A lot of politics, a lot of overwhelm, I think all adds into it.
Yeah, I think there has been a lot of politics. I mean, even in some capacities, you see even Dr. Fauci, head of the department, kind of experiencing the effects of politics. So when he's dealing with that, in a sense, it's almost like, is there time left in the day to then go back and look at potential effective treatments to save lives if you're sort of stuck with bureaucratic issues?
Yeah. Yeah. Unfortunate.